Yeah, I see it all now. Thank you.
Okay. Good afternoon and welcome. Welcome to the fall edition of the Children's Cancer Cause webinar series. My name is George Dahlman. Oh, let's wait a minute. I got to start the broadcast. Good afternoon and welcome to the fall edition of Children's Cancer Cause webinar series. My name is George Dahlman and I'll be your moderator for the session. This is the latest in a series of webinars hosted by Children's Cause to inform and help mobilize childhood cancer advocates. Today's edition is, as we finish the last days of the Childhood Cancer Awareness Month, is on the subject of survivorship and the prevalence and the challenges and the policies that are associated with it. All things that I think many of the people on this call are all too familiar with. Before we start, I want to go over some reminders and housekeeping items. If you need technical assistance, you can dial 202-487-3270. Again, 202-487-3270, and Jess Keene will try to help you. Today's call is being recorded and it will be available on our website at childrenscancercause.org afterwards. And we're joined today by two distinguished panelists, each of whom has been instrumental in working on initiatives that improve the care of children with cancer and survivors. The format for this will be a brief update on some efforts by Children's Cause in this space, and then we'll hear from our guests. During the course of the webinar, everybody is on mute, but if you have any questions, you can submit them on the right-hand side of your screen. There's a Q&A box, and we will get to those at the end of the discussion. At the end of the webinar, you'll be automatically redirected to a post-webinar survey. So if you could take a few minutes and complete that, and it's important to us because we model this and change it as time goes on based on feedback from participants. As a father of a survivor, I have to tell you this topic on survivorship is very important to me, and we're fortunate to have with us today two experts in the field to help understand some of the initiatives that have gone on and the challenges that families face. Dr. Gregory Aune is Associate Professor of Pediatrics at University of Texas Health San Antonio's Greehey Children's Cancer Research Institute. And Dr. Aune has been a patient himself. As a teenager, he faced Hodgkin's lymphoma, an experience that inspired him to become a pediatric oncologist. And now he's a national leader in the field of cancer survivorship and an incredible advocate for more funding and care for the nation's childhood cancer survivors. Also joining us is Julia Rowland. Dr. Rowland was formerly the director of the Office of Cancer Survivorship at the National Cancer Institute, and she is very widely recognized as a national and international scholar, researcher, and leader in psychosocial aspects of cancer. And she was also the recipient last year of the Children's Cause 2018 Rosen Research Award, which I'll highlight in a little bit. So I wanted to point out, if you haven't seen already, that we recently changed our name. We have been the Children's Cause for Cancer Advocacy. We recently, as of September 1st, changed that to Children's Cancer Cause. It's a little more succinct, more easily found on the web, and also corresponds to the fact that we are now celebrating our 20th anniversary this year. It's been 20 years since Susan Weiner started the Children's Cause, and we're still going strong. But what hasn't changed is our mission, and we still fight for more NIH and NCI research funding. We are still working with pharmaceutical companies and with academic researchers on new treatment developments. Along the pipeline, we are still very frequently in touch with the FDA on the regulatory aspects of getting those treatments to patients more quickly. And in the course of this, what we try to do is also train advocates to be the voice of children with cancer themselves, and working with different foundations, family foundations around the country on national issues, but also increasingly on state issues too, with frequently on insurance coverage issues. The core of what Children's Cause has always been about for years has been on survivorship, and most of us know that the STAR Act was a huge achievement for for the community last year when it was passed. And it was really a collaboration of a lot of different organizations that contributed different priorities to the overall package. One of the core functions was, in fact, on survivorship that the Children's Cause had been working on for years. And it's now the subject of some research grants at NCI. And so we're building off of that with a demonstration project that we are pushing right now on Capitol Hill and in the administration to do a Medicaid demonstration that would provide for payment for the development of survivorship care plans and a transition of kit to care to general practitioners or pediatricians. Last year, we hosted a patient-focused drug development conference with which Dr. Aune was involved with and spoke at. And we really focused on one aspect of survivorship, which is hearing loss that many kids and young adults experience as a result of their treatment. We also started 3 years ago the Rosen Memorial Research Award, which recognizes and encourages more research into survivorship and other pediatric cancer issues, and Dr. Rowland was a recipient of that last year. And then we also last year began a college scholars program, which is just a scholarship grant to students every year to help with their college education. And the reason that we continue to do all these things is because, as Dr. Aune and Dr. Rowland will talk about, is that the numbers are so staggering now, and the extent of it is so large, and the health aspects of it are so severe and challenging and threatening to all of our kids. It's estimated this next year, there'll be 500,000 childhood cancer survivors. And that's becoming more of a public health issue, with 1 in 530 young adults with this history. Now, more than 95% of kids or survivors will have a health-related issue, a lot of it having to do with their cancer, or more likely the result of their treatment. And two-thirds really will suffer severe types of health problems because of their experience. And I think there's probably no better person to talk about the personal side of this, as well as the clinical side of it, than Dr. Aune, who has been a patient himself, and also treats kids and has seen the effects in survivors. So, Dr. Aune, if you would talk about something about your experience and what you see in the clinic, that I think would be very enlightening.
Great. Thanks, George, for that really good introduction. And it's truly a pleasure to be able to talk to everyone about survivorship and in particular my journey as a survivor. So, my path to being here today, speaking to everybody during Childhood Cancer Awareness Month, which is a month that I get a chance to tell this story a lot. Goes back almost 30 years now, when I was diagnosed with Hodgkin's lymphoma as a teenager. At the time, I was a young high school student with kind of thoughts of playing sports and interested in school and doing well at school, but hadn't really ever considered going into medicine or anything like that. And I think my experience as a patient put me on that path to my professional career. What I experienced in the immediate period of time as a cancer patient was a lot of toxicity, acute toxicity. So as I went through that first year of treatment and dealt with everything that came with it, I just continually asked myself, is this there has to be there has to be a better way of treating cancer, and why is the only thing we have these really toxic medications? And through that process, I kind of decided that if I was able to get through the experience, that I was going to try to go on and contribute in some way to hopefully creating a situation for future patients so they didn't have to deal with some of the things that I had to deal with. What I didn't see coming at the time was what I think happened over the subsequent years of my survivorship. I'm very blessed and fortunate to be a long-term survivor now. As a patient, going through Hodgkin's treatment, I was, kind of, the situation was presented to me as, get through these treatments. You're going to be done with this, block of therapy that we show you on, the schedule here. And when you get done, everything's going to kind of go back to normal. At least maybe that's how I wanted to see it. And then you get done and your life's kind of turned upside down. And I would definitely, things weren't normal. And they never really have got back to what normal from a health standpoint. I think over the years, I've just continually come up with new health problems that resulted from some of the treatments that I'd gotten. And I experienced this in the period of time, which I think our next speaker is going to highlight, where there was a lot of survivorship research going on because the field of oncology was starting to realize that these treatments carry significant long-term potential to cause health effects. And so as I was a graduate student and medical student and keeping up with this literature from a personal standpoint, I would get things like hypothyroidism, and then I'd read a new paper. And one distinctly that I remembered reading was a paper about heart valve defects and kind of heart issues, and it really kind of freaked me out a little bit. And I remember thinking, I wonder if I'm going to get that. Well, sure enough, that's one of the things I got about 6 years later. I had to have open heart surgery to replace my aortic valve, and I got a triple bypass at the same time. So it's a pretty significant heart damage from the radiation that I received. I've had a mild stroke. I've had developed diabetes. I suffer from infertility, but fortunately, I have two sets of twins that are now 16 and 11 from sperm that was donated before I started my chemotherapy treatment. So very fortunate in that regard, and not all of our patients have that opportunity. But what I've learned by experiencing all of those, kind of unfortunate health effects is that cancer is a lifelong disease. And professionally, what I've learned as I kind of look at my own individual case and then put it in the context of the patients that I see and the survivors that I've met through some of the national advocacy efforts I've been involved in, is my case is not unique. It's the norm. So most of our patients will have that kind of story where they accumulate, an array of health complications, and our medical system is really starting to try to figure out how we're going to deal with this population. George had a good slide that detailed the numbers of the patients that are out there, and this number is only going to get bigger going forward. And so when you think about the population, what I wanted to end with was just to kind of highlight some of the gaps in the care of survivors. So the first is if you think about, I look at my own case and where I received my medical care over the years and where I receive it now, we really haven't definitively decided as a field who's going to take care of these patients. And there's a variety of factors why that's the case. But what this has resulted in, unfortunately, is that there's a large number of patients out there with respect to the childhood cancer population that is not getting kind of annual visits that are focused on screening for these late effects. And that's a really big problem, because as patients age, we know their risks increase. So there's been some good studies that have looked at follow-up with respect to years post-treatment. And what they very clearly show is that as patients get further away from completion of therapy, the rates of follow-up in a survivorship program decline. And so if you think about what happens there, these health problems are not necessarily within the first 5 to 10 years of completing therapy. They're more likely in the childhood cancer population to occur 20 to 30 years later and beyond. And so right as patients are beginning to have an increased risk of health complications, that's about the point where their follow-up drops off. And so this is a major gap, and one that needs to be addressed. The second big gap is just thinking about, and I think it's one of the causes of why survivorship care is not very extensively out there for patients to access, is that the reimbursement for survivorship and those types of visits is not robust. And so there's not a big financial incentive for practices and providers to focus on survivorship care, and therefore what we have is less survivorship care. And then lastly, a gap is just educating patients. So I think Dr. Rowland's going to talk a lot about this in some of her slides, and that's around the mandate of providing a care plan to each patient. So since these effects of therapy are focused on are related to the type of exposures patients received, we now know a great deal about what a patient might be at risk for based off of what type of treatment they received. And so survivorship care plans are really focused on giving the patients the tools to advocate for themselves. And I kind of look back on my own case, and I was able to do this. There was no survivorship care plans when I was in the early part of my survivorship journey, but effectively I was doing that by kind of keeping up with the literature from a personal interest standpoint as I went through my training, and then going to my oncologist or my primary care doctor and saying, hey, I think this year I probably need a colonoscopy because I have this abdominal radiation. And so, but we need to give all our patients the tools to do that. And survivorship care plans are one of the ways that we can do that. And in children's, in the childhood cancer survivor population, there are some tools that have been put together. One of them is a program or a web-based application called Passport for Care, which is available through many of our COG institutions, and my institution actually is one of the members that participates in this program. But it's really meant to be a central clearinghouse for survivorship patient data for both the practices, and then now the patients have access to their own records as well. And out of that can come a survivorship care plan, and then it also communicates directly with the body that develops the screening guidelines. So as those change, the care plans that we provide to patients actually change as well. But the point is that there's tools out there to take care of these patients and help educate them, help them to advocate for themselves. And going forward, it's going to be increasingly important that we work diligently to solve some of these problems and address these gaps, because the population is growing, as I think many of you know, because our survival rates are continuing to improve, which is a good thing. And they're aging. And so as our patients age, there's going to be more of these issues that become more prominent. And so going forward, it's just exceedingly important. And I think, those of us that are working in oncology and pediatric oncology and working in survivorship, we still, have this vision of a day where we can, tell a family that your son or daughter has, leukemia or a cancer, which is a life-threatening illness, but that we can eradicate that disease. But then also now, in the future, hopefully we'll be able to tell them that it's going to be a full life without a lot of major health complications once they get through the treatment. And I think that's the vision that I have for my patients and the people that I get a chance to talk to. It's the to give patients the cure that I've experienced and been blessed with without all of the health complications that came afterwards. And I'm going to hand it over to Dr. Rowland now, who's going to, I think, kind of give a history of a kind of survivorship care and research in the United States and beyond, and really talk about what's the NCI and what have we done as a field to address this problem.
Julia?
So thank you so much, Dr. Aune, for that wonderful chance to set the stage for the dialogue this afternoon. My special congratulations to the Children's Cancer Cause. Love the new name. It slips off the tongue wonderfully. 20th anniversary is incredibly impressive, and of course a wonderful tribute to Susan Weiner's original vision for what we needed in terms of caring for what is now a growing population of individuals who are going to live not just with, but through and beyond a diagnosis of childhood cancer. What I thought I would do in the few minutes that I have this afternoon is part of the dialogue, talk a little bit about what we know in terms of numbers and what are the effects here. And then as Dr. Aune mentioned, talk a little bit about what do we need to be doing now to take care of this population. So I'm not sure if I'm going to be able to move
Julia?
my
Yeah,
slides.
I think
Yep.
you have control.
Okay,
There
I
you
do.
go.
Look at that. Terrific. So this graphic slide is just a way of portraying the fact that we have a population of individuals in the United States now of survivors that's just growing over time, and that trend is not going to stop. Currently, as of 2019, there are 16.9 million individuals with a cancer diagnosis in the United States alone. And when you think, oh gosh, what's a 500,000 in that? Seems like a small proportion. That's our childhood cancer survivors. And yet the most important thing to recognize about this figure is that if I were displaying this just for our childhood survivors, most of them would be in that top turquoise light blue area of being 15 years out or more, because we've had such dramatic success in controlling and curing childhood cancers, much faster success than we've experienced on the adult side. And as a consequence, our childhood cancer survivors have become the vanguard in many ways of the survivorship movement. We have much more data about their long-term and late effects than we even do among adult survivors. And certainly what we've learned from that has been, as Greg pointed out in his own case, very sobering. What we've seen is that individuals who have finished their treatment recognize that it's not really over when it's over. We'd like to say, congratulations, you finished this therapy, now you can pick up your life and move on and live happily ever after. Unfortunately, that is not the case. Most individuals can expect to live decades and more beyond childhood cancer diagnosis, but there may be very diverse long-term and late consequences to that. And we see this in all domains of an individual's functioning, perhaps most recognizably on the physical domain, where there may be persistent problems with fatigue or cognitive memory, attention issues, hearing loss, amputation, fertility impairment, growth issues, so not growing to the height that you might have anticipated, concerns with anxiety, depression, will the cancer come back, altered body image, and sense of isolation. This experience is very differentiating for young people who've gone through it. Economic challenges and social challenges, changes in being out of sync with your peers, perhaps, returning to school, issues regarding getting health and life insurance because you have a cancer history, later potentially for job discrimination or financial burden because of the cost of your ongoing care. And finally, this kind of sense of what's your role in life and family now? How do you make sense of this? And have to come back, as many survivors talk about it, of childhood cancer, reinterpreting that experience. So what happened when you were 7 may get reprocessed or rethought about when you're now 20. When you start thinking about family, you may revisit that again, and on through your life course, which is sometimes very unexpected for many individuals. And then, of course, there are the late effects, so occurring months, but in this case, usually years after the end of treatment. Top on that list is disease recurrence among young cancer survivors, or new cancers that develop, as you heard Greg say, some of these late effects, cardiovascular disease, obesity, diabetes, bone health issues, stroke, functional decline, poor quality of life. All of these, we've learned over time in studying the growing population of survivors, have argued that we need to plan for life after cancer, and that is crucially important. One of the reasons we've been able to do so much of this research is really as a function of advocacy. So back in 1996, a woman named Ellen Stovall, who was then president and chief executive officer for something called the National Coalition for Cancer Survivorship, took a white paper that many of us had worked on, outlining what were the challenges to individuals who were living long-term post-treatment, and presented that to the then director of the Cancer Institute, Richard Klausner, who then turned around himself and created what we now know as the Office of Cancer Survivorship at the National Cancer Institute. That office was created specifically to stimulate and help direct research looking at what were the long-term and late effects of living with a history of this disease, and what were ways we were going to prevent adverse outcomes or mitigate the effects of these. I was, as was mentioned by George, I had the privilege of serving as the director of that office for 18 years and saw that research really take off. And it's been that research that's raised our awareness about what we need to be attending to. And it also helped stimulate 3 big national reports looking at the challenge of cancer survivorship more broadly. The first of these looks specifically at childhood cancer survivors. It came out in the form of a 2002 report issued by the Institute of Medicine, now the National Academies of Medicine or National Academies of Science. And in it, it chronicled a list of challenges that were faced and objectives for us to meet to address those. In 2004, the President's Cancer Panel tackled this topic, covering both pediatric cancers and adult cancers. And then in 2006, the Institute of Medicine returned and looked at what we need to do just for adult survivors. But compelling in all 3 of these volumes was a very important message, and that was that when treatment ends, it was recommended that all survivors receive a summary record that included some of the important details about their illness and also be provided with a follow-up care plan. Together, these 2 parts, the treatment summary and follow-up care plan, are now being referred to as survivorship care plans or SCIPs. This recommendation has actually become a movement across the United States. Enormous attention on how do we do survivorship care planning. And the 2 parts to that are important are the treatment summary is needed because you need to know what kind of therapies you received. So I take Dr. Aune's case where you would need to know he received radiation to the chest, exposing various vital organs and also his heart. So this was putting him at risk for a late consequence of his treatment. So you need to know what kind of treatments were received, what kind of cancer was treated, what its stage was, if there were genetic markers done, what that was like, surgery if it was performed, chemotherapy if this was delivered, complications that might have been experienced by the individual during treatment, and services used. So that treatment summary is very important because it's then used to populate what's called the follow-up care plan or survivorship care plan. And that has 4 main components. So if you're thinking about your own care or a loved one's care or individuals in your care as a healthcare provider, there are 4 pieces that need to go into this document. First and foremost is what needs to be done to make sure the cancer or a new cancer does not come back or occur. So what kind of screening would that entail? How often is that going to be done? The second is assessment of ongoing or problematic issues. So if you leave treatment and you're struggling with school issues, is a recommendation made for you to go to some kind of remediation or get help for that? If, again, as Greg mentioned, you have infertility problems, what's going to, or likely risk for infertility, what could be done to address that? And the third compartment is really prevention of late things. And this is really the theme in some ways to emphasize today. What can you do now to both remain healthy and to prevent later effects occurring? And this, up until I would say the last few years, last maybe 5 or 6 years, had been largely ignored. That sort of what should we be doing to prevent these effects, because we are only just accumulating knowledge about the effects and not trying to step in and say, well, gosh, maybe we need to do screening earlier, take a look at your cardiac function, and make sure your cholesterol levels and your metabolic status is good and your weight is not too heavy, et cetera. Reduce any known risk factors for developing this so that you don't develop this complication unnecessarily because we failed to include health promotion as part of the recommendation. And finally, the most complicated piece, especially in our current healthcare delivery system, is communication and coordination. This is a particular challenge for childhood cancer survivors, many of whom may have gone to a very special treatment site for their original care and are now back in their home communities where people don't know about their history or don't know a lot about the treatments they received. So having some kind of a documentation about what that was so that it informs whoever your healthcare provider is going to be in the decades to come is very important for ongoing care. I will note that even if you don't have one now and you're a survivor, you can make one now. You can have one created and move forward with that. And that's something really important to think about. And it's aided by the fact that, as again, Dr. Aune mentioned, the Children's Oncology Group put together a wonderful document that includes follow-up care guidelines. And they did this one, what's called an exposure basis. So it's not necessarily you'll go in there and say, well, I had leukemia. What are the guidelines for leukemia? They're going to ask for information about the treatments because it's the treatments they want to find out that may affect your care later. And as Greg mentioned, the Passport for Care is an outstanding resource for this. The website for this is provided, and what the group did there, and I might add that David Poplack, who is the mover and shaker behind Passport for Care, will himself be the recipient of Leonard M. Rosen Memorial Research Award from Children's Cancer Cause this year. He's this year's recipient, and this is a brilliant piece of work that he's done that's made it possible for individuals to go in, load that information about their own treatment, and it automatically populates a health record for the individual about what his or her follow-up should entail based on exposure, based on the age of the individual, other potential risk factors. I love it because it's really something that the survivor gets to control. It's HIPAA compliant, so you can share this information if you're a survivor, or you can direct to whom you want to send that information, which of your providers. You can see if your providers are looking at it, important. And it also provides ongoing updates for health behavior. So if we know about new vaccines for health that are come out, say a recommendation about HPV vaccine or flu vaccines, et cetera, those are automatically in your health record, which is a terrific tool and asset to have. The final issue here, though, is, and again, as Dr. Aune mentioned, while this has had a lot of attention, the idea of survivorship care plans in the adult cancer arena, there's been very slow uptake actually in pediatric oncology arena. And the only quote unquote teeth to this, in other words, we know what the research shows, there are guidelines for this, but are there requirements for delivering this care? And the answer at the moment is not really. There is an organization called the American College of Surgeons Commission on Cancer. The Commission on Cancer is a credentialing body. It certifies medical centers, in this case, cancer delivery centers, with regard to standards for quality of cancer care delivery. So these centers, and there are about 1,500 of them across the country or more, almost all the NCI, National Cancer Institute designated centers, have this certification, so they're held to this standard. And in 2012, they developed 3 standards that were released in 2015 about ensuring availability of patient navigation through treatment, screening for distress early in the course of care, and importantly, survivorship care. And as part of this last piece, what they recommended was that everybody finishing their care receive a survivorship care plan, and that this be given to the individual and or his family or her family, and also to the ongoing care provider. So if there's a primary care provider, that individual receives a copy. The problem with this is that it's what we call, oops, I've pressed too hard, an unfunded mandate. In other words, it's a credentialing factor out here, but there aren't monies, again, as Dr. Aune said, to do this. And in that regard, the Children's Cancer Cause and other advocacy organizations like the National Coalition for Cancer Survivorship are advocating that Congress pass bills that require healthcare providers and insurers to pay for this, in particular Medicare. If we can get Medicare to pay for these kinds of conversations and for someone to sit with an individual, help develop this plan, and most importantly, talk about it. It's not about a piece of paper. It's about a conversation. What happens now? What do I need to be doing for my care? What's available? What's going to happen going forward? Very important. It's not a piece of paper. It's about the conversation. So what are the take-home messages that I want to share with you? One is that cancer survivorship is, again, a unique phase of the experience, bringing its own challenges and rewards. I say that because I have a very dear friend and colleague who was a long-term cancer survivor who had multiple complications from her illness. She, again, was a Hodgkin's disease survivor like Dr. Aune, who subsequently developed cardiac problems and a second malignancy that she referred to in terms of her cancer treatment as the gift that keeps on giving. And many people may feel that way. The life given is a gift, but it doesn't come without a price tag. And so preparing for life after cancer is very important. And that means asking for and discussing a survivorship care plan, finding out what's needed for you, particularly to remain healthy and thrive, and being sure that this includes mind, body, and spirit. How are things at home? How is school? How are you feeling emotionally? What challenges do you perceive? And to update this regularly. It's a living document. This is not a one-time activity. I wanted to make send two more messages, and that is the Institute of Medicine in 2007 also presented another document in which they said that cancer care for the whole person means that addressing psychosocial needs has to be part of integral quality cancer care. So asking for resources and support in that is very important. And second, the other important thing we've recognized, and I've tried to emphasize before, is the vital role that healthy lifestyle plays, in particular for our survivors of childhood cancer. Where going forward, this population is aging, and what we worry about is that we don't want to keep seeing come up what looks like a premature aging or an accelerated aging course. Again, using Greg's own experience, he had big cardiac surgery second to his curative therapy for his Hodgkin's disease, that for which he probably had very little information or warning about what might have been important for him to try and control that might mitigate that. And he had it at a much younger age. So where we might expect someone to have cardiac surgery and they're over 65, having this as a young adult is very unusual. And so what we're seeing, and we want to try and mitigate, is that kind of effect in our young survivors. And that means attending to physical activity, making sure that you quit smoking or don't take up smoking, that you're using sunscreen, you modify your alcohol input, you have a balanced, rich, nutritious diet, and that you're getting your routine screening for cancer and other illnesses, and that you're getting appropriate and needed vaccines. So the final piece in here is you need to be an active participant in your well-being, and you need to know there are lots of resources available, many of them supported by Children's Cancer Cause and others. And I want to end by saying, for all of us who've done research in this area, the biggest and most important lesson is that we need to listen to survivors, and that is critical. Asking and listening to their telling us what's happening to you, how can we help you lead a full life. And when we do that and we all work as a team together, what we can say is that for our population of childhood cancer survivors that continues to grow, there is good quality of life to be had when we work together as a team to secure that. Thank you.
Thank you, Julia. And Greg, those were great. I think you both touched on a couple of things that I'm going to slip through this quickly. You both touched on a couple of things that I see professionally and also personally. One is that it is the care for survivors is so fragmented, and particularly because they leave the institution that they were originally treated at and go off in the world someplace else. And the passport for care is probably one of the better pieces out there. And that has challenges too for patients and the number of patients that are actually able to use it. I mean, and just as I said, I've used my own experience is my son is some 20 years out from his treatment, and only recently did we have his information put in Passport so that he's able to use it in follow-up care. And I know as he's approaching 30 years old, he he's going to need it more often. He's going into more high-risk age groups. Um, at this time, I'm going to move this along here. Um, you had some pieces here, Julia, about the Smith Center.
Yeah, well, you have to do. If I'm going to talk, I have to do a plug for my little outfit.
Okay.
We don't target necessarily childhood survivors during the younger period, but we do have an extraordinary and very vibrant young adult program. So this is at Smith Center for Healing in the Arts, which is based in Washington, D.C. in the U Street corridor, and we must have about 150 members of that group DC wide. So this is really a broad collaborative of care centers around the larger DC community that comes in, and they have their own program, and they take advantage of the kinds of things that we promote here, which is really health and wellness during and after treatment, and even when somebody has ongoing active disease. That includes support groups, patient navigation, yoga and stress management. We have residential retreats, and we do cooking and nutrition. And all of this is also very focused on the arts, because we have a art studio built into our space, a gallery, and we feel that creativity is really important to recovery and whole person health. So that's my quick plug for what we do. If you don't know about us, I hope you go online at smithcenter.org to hear more about what we do. Anyway, thanks for the opportunity to make my plug, George.
No, that's fine. I'm going to move on to I just wanted to put a plug in for us at the end too, and there's a question or two here. But if anyone out there listening or watching this really wants to become more actively involved, it's one of the platforms that we offer at Children's Cause is to become part of the Kids Action Network, and that will give you the opportunity to get some training and some tips on advocating more effectively with your legislators and with policymakers. And it also enlists you in our legislative action center, so you'll receive notices about when something comes up that's very timely. So if you'd like to, we would very much appreciate it, because the more people involved that can be voices for children, the more effective we'll be. And now I do want to turn it over to see, we have a bit of time left for questions. One that I have here is, Julie or Greg, do you know, are there trials out there for current pediatric cancer survivors to be followed under? I feel pretty certain that there probably are, but just wanted to find out if you have any advice on where to go to find those.
Right. Well, the National Cancer Institute supports a couple of very large cohorts of childhood cancer survivors. One literally called that Childhood Cancer Survivor Study, or CCSS, that has two large nationally recruited cohorts that are being followed over time. So those curious about what we're learning can go up on that website. So again, Childhood Cancer Survivor Study, or CCSS, probably a Google search would get you there. It's housed at the moment in St. Jude's. And we also have the St. Jude Life. They follow the children who are fortunate enough to be treated at St. Jude's, often are followed for life at that center, often coming back regularly for long-term visits. In terms of clinical trials on survivors per se, people who are post-treatment, they are beginning to be studies as we use that the Childhood Cancer Survivor Study as a platform to reach out to individuals. We've got a couple studies going there, and one in particular that comes to mind, where they're looking at Hodgkin's disease survivors who are young women now, and whether they're getting screened for breast cancer, for which they may be at increased risk, again, because of their chest irradiation exposure to breast tissue. There have been studies looking at smoking cessation in this population too. because we're worried that this may be going up with a recent introduction of vaping products. This is a big concern for us. Certainly not something you want to do if you're a childhood cancer survivor or not, but you want to stay away from tobacco products in every effort. So those are some of the ideas of things that are going on now. The final place one could look to see where some of these studies are is the Office of Cancer Survivorship, the office I directed up at the National Cancer Institute. We keep a listing. If you go to the Office of Cancer Survivorship website or home site, you will find a link to a listing of our current grants, and you can scroll through and see who's doing what kind of research, perhaps in your background or your neighborhood.
Right, exactly. Looking at a couple other questions here. Sorry. Yeah, and I think Julie, to your point, I mean, we've brought up we did that patient-focused drug development piece last year on hearing, and there was a study not long ago too, I think, on childhood cancer survivors and skin cancers, that they were more susceptible to those by quite a considerable amount too. So that's another area that I think they'll survivors and their families will want to keep an eye on. There is also, I wanted to mention, we are currently, and Julie's been trying to help us with this, trying to develop a program, a pilot program with, there's a board member of ours who is very interested in developing a kind of a pilot project to test kind of implementation strategies for childhood cancer survivors. A lot has been written, as we're talking about the risks that they face, but not a lot has been documented about, and Julie, you can talk about this better than I can, about what's the most effective routes for a lot of these patients or people over the course of their lives as survivors. And I think that's one of the areas we want to try to address.
Yeah, that's a great point, George. I mean, one of the challenges, and I'm sure Greg probably has some thoughts about this too, is that there are a variety of models for follow-up care in the pediatric arena. Again, that has been our vanguard arena for the survivorship focus. Way back in the early 90s, they were the group that first started doing clinics, often multidisciplinary clinics with a variety of different providers, not just medical oncologists, but child life specialists, neuropsychologists, nutritionists, et cetera, as part of the team, would evaluate individuals who have been treated in a kind of a full service setting, often connected with the treatment setting. So the children be treated, they finish, they graduate from that, and then be followed up in these specialty clinics. That's kind of the Cadillac version. But given that many individuals go back home to locations that may be distant from the treating center, it's been more of a challenge about how do you deliver this care. And there are multiple models that are potentially out there, and that is, training or educating primary care clinicians about how to deliver this care is one way people have been thinking, and have sort of a shared care model where there's communication back and forth between the oncology team and the primary care provider. There are multiple challenges to that, not least of which is that because childhood cancers are still a fairly rare occurrence, there are not many individuals in a given pediatric practice who are affected by that. And so trying to train up primary care providers is a little bit more of an uphill battle. But if we had some interface where you might use something like Passport for Care that would be ready access for the primary care clinician, it might be a model that would work. Or other thoughts are a consultative model where you have experts in a couple of centers around the country where they could do a consultation either in person or maybe virtual, and then help an individual develop a care plan. Those are kind of some of the things that are floating out there. But again, Dr. Aune, maybe you have thoughts about that?
Yes, I do. I was trying to wait for the right time and jump in and get my mic unmuted at the same time, so I missed a couple times. But with respect to the clinical trials, I think you mentioned some of the activities that are ongoing, and I think through through the CCSS, there's multiple children's oncology group institutions that have survivorship programs that have patients that are part of that cohort, and there's a lot of work going on in looking at various late effects and causes of late effects. And then I think there's even I think encouragingly there's some what are called intervention studies. There's one looking at a strategy to kind of decrease, hopefully reverse the untoward effects of anthracyclines on heart function through use of a calcium channel blocker, and similar studies. And then with respect to the STAR Act, I think it's really important to highlight that the advocacy and all the effort that went into that, and the focus on survivorship. There's already been money, and I believe the grants were announced within the last few weeks on some U01 grants to look at intervention studies in additional intervention studies. So there's going to be even more of that type of work going on. And within the STAR Act, there's also a provision to look at this issue of models of care. And so I think that's going forward probably one of the most critical areas of research for our population is really trying to get our heads wrapped around how are we going to solve the problem of caring for them, and what are the the ways that we can do that. And I think it's going to be it's not going to be the same model in all over the country, because it's just there's healthcare is so complex that it's just very difficult to take something that works, say in a big city in the Northeast, and extrapolate it to a rural area in the Southwest, for example. And so I think we have to think creatively, and I think the way we're going to get there is hopefully through the National Cancer Institute continuing to support this initiatives in terms of survivorship research, and funding some work on different ways of caring for these patients, with the ultimate goal of getting our follow-up rate to close to 100%, where they're all engaged somewhere, whether it be with an organized long-term follow-up program like St. Jude for Life, or a well-educated primary care physician near their home in a rural area, for example. So I just think it's a really exciting time going forward, because I think there's been a lot of work to establish this as a problem that needs to be solved, and I think we're kind of at this inflection point now going forward. There's a lot to do in terms of improving the health, and we have a lot of tools at our disposal. There's some scientific research that I think is ripe to be done, and there are some really good organizations and people really motivated to try to push this ahead and continue improving our quality of life for these patients, and that's ultimately what we're after.
That's great. Yeah. I just wanted to add in there, our friend Ellen has pointed out there is a research spotlight section in the Passport for Care that lists the current COG studies aimed at survivors. So that is a source for you to go to see what is happening there. And let me see if there's any other questions. I don't see too many others. That's great. Well, if there are any others, I just want to let everybody know that you can watch this webinar again and hear the guidance of both Dr. Aune and Dr. Rowland at your leisure. And if you have any other questions or would like to volunteer in any other way with Children's Cause, I hope you'll please contact us at childrenscause.org, at our website, childrenscancercause.org, or call at 202-552-7392 to our office number and leave a message, and we will be sure to get back to you. I think that will pretty much wrap it up for today. Thank you all very much for taking the time to be with us today. And if you if you could, please also respond to the questionnaire you'll receive after this is finished. And then please let us know what your thoughts are. But until then, thank you very much for your attention and for joining us today. And we'll see you again in another couple of months where we'll have another edition of the webinar. Thank you very much.